Why don't we go ahead and get started? It is about 7:05 and we want to respect everybody's time tonight. We do appreciate you joining us. I'm Ted Burton. I'm Vice President of Communications at Central Health. This is our third town hall in a series of town hall meetings, COVID-19 and our community, facts, myths, and overcoming fear. It's my pleasure to be your moderator for tonight's conversation. I'm going to do my best to help guide the conversation and stay out of the way so we can take questions from those of you who are watching via Facebook Live and have plenty of time for our distinguished experts on our panel tonight. Central Health and Community Care are honored to partner with Austin Public Health, the Community Coalition for Health, and a number of local churches to bring you this town hall series. As you may know, Central Health is Travis County's healthcare district, and Community Care is part of the Central Health Enterprise and one of the largest federally qualified health centers in Texas. Tonight, we hope to have a candid conversation about barriers preventing communities of color from getting the COVID-19 vaccine and what we can do together to address and remove these barriers so we can all get back to normal together. We'd like to begin tonight with an invocation. Joining us is Pastor Barbara Shirley, a longtime Community Care board member and friend. Pastor Shirley.
Thank you. Let us pray. Loving God, you fill all things with fullness and hope, and that we can never comprehend. Thank you for leading us into a time where more of reality is being unveiled for us all to see. We pray that you will take away our natural temptation for cynicism, denial, fear, and despair. Help us have the courage to awaken to greater truth, greater humility, and greater care for one another. May we place our hope in what matters and what lasts, trusting in your eternal presence and love. Listen to our hearts, longing for the healing of our suffering world. Please add your own intentions, knowing, good God, you are hearing us better than we are speaking. We offer these prayers in all the holy names of God. Amen and amen.
Thank you, Pastor. We really appreciate that. What a nice way to start this conversation. Mayor Adler may join us tonight. He has a really busy schedule today, and if he does, we will welcome him to the conversation. I know he would have a few words to say if he's able to join. I would like to welcome our panelists, and I'll let them introduce themselves and share a few words about why they're joining this conversation tonight. On the call, we have Pastor Deshard IHM Freeman with Abundant Life Church joining us. Hopefully, he'll be joining us, and he is here, is Pastor Arthur Sneed II with South Austin Community Church. We also have Mia Greer. She's a registered nurse and COO with Community Coalition for Health and an elder with the Rock ATX. And joining us from Community Care is Shelly Ann Hines, a certified physician's assistant. We also have the director of Austin Public Health, Adrian Stirrup, and Mike Giesland, who is president and CEO of Central Health. I would like to go back and just let people introduce themselves and just tell us a little bit about why they wanted to be part of this conversation tonight. And Pastor Freeman, if you don't mind, I will start with you.
Good evening. As it was stated, my name is Deshard Freeman. I'm the lead pastor of the Abundant Life Church. And obviously, I want to be a part of this conversation because of how COVID-19 has kind of drastically impacted our world at large, but especially how it has impacted the African American community of which I'm a part and which I have given my life to serve. And so I'm excited that this conversation is happening so that more education can take place for those who may be uncertain or have certain levels of fear.
Thank you, Pastor. Pastor Sneed, I believe I've seen you join the conversation. Are you there? You are. Hi, Pastor Sneed. Welcome.
Hello, good evening. God bless you and everyone that's watching and a part of this panel. As stated, my name is Arthur Sneed II, and I pastor the South Austin Community Church here in Austin, Texas. And I'm blessed to be here and a part of this panel to do my part. Whatever I can do to potentially encourage someone to be a part of taking or being vaccinated, or even from a spiritual standpoint, eliminated some of the myths that have been stated, and we address individually, but then hopefully prayerfully, everyone can share content and information, and I can join that conversation and potentially helping and encouraging someone to take that step toward vaccination, or at least being educated and more enlightened in the midst of this conversation as well.
Thank you, Pastor. I'd like to also introduce the Director of Austin Public Health, Adrian Stirrup. Welcome, Ms. Stirrup.
Thank you, Ted. Welcome. Yes, I am honored to be here tonight. For professional reasons, as the director of the Public Health Department, it's my duty to be a part of these conversations and make sure that all of our communities, especially our communities of color that are suffering disparate outcomes due to COVID, get access to information. And sometimes it's going to take those real conversations. And on a personal level, I'm a woman of color. My mother is Panamanian, so in some circles, they would consider me an Afro-Latina. And so when I see the data about my community, I don't see numbers. I see my mom, I see my dad, I see my cousins, so I'm personally driven to make sure that, not to coerce anyone, but make sure you have all the information you need to make a good choice for yourself.
Thank you so much. We also have Mia Greer on the panel. Mia is one of our partners at Central Health, and the organization that she is with, Community Coalition for Health, has been instrumental in helping us plan and produce these town halls. Elder Greer?
Well, the reason why this is a passion for me is equity has always been a passion for me when it comes to African Americans, and how we tend to get the worst of the worst, the last of the last, and we are the first to go when it comes to health equity, mortality, morbidity, and COVID just rose that to the top on how disproportionate healthcare can be when it comes to African Americans. So I wanted to kind of level out that playing field by getting us to get out and get vaccinated.
Thank you so much. And thank you for helping us organize these really important town halls. And Ms. Hines from Community Care, certified physician's assistant, and she will be providing some really important healthcare and medical information tonight. Ms. Hines?
My name is Shelly Ann Hines. I'm a physician assistant at Community Care. I've been with the organization now for over 12 years. And I'm here to answer any medical questions that I can possibly answer.
Well, we appreciate you being here, and we know you've been extremely busy the past 14 months and before. So thank you for spending a little bit of time with us. And also Mike Giesland, the president and CEO of Central Health. Hi, Mike.
Good evening, and thank you all for joining us here this evening, and those of you that are on this call and then watching on Facebook. This is important to us. It's an important way to connect and have those real conversations. And whether you're coming at this from a personal standpoint, or a place of faith, or just a place of curiosity or concern or fear, I think there's a space here to have a lot of different conversations for a lot of people. So thank you all.
Thank you, Mike. And I want to thank everybody who is joining us via Facebook Live. You are invited to drop questions via the comment section on Facebook Live, and we will try to respond to as many questions as possible during this town hall. And then you can continue to leave comments after the town hall is over, and a member of the Central Health team will address those comments and get back to you. We do believe this is a conversation, and so your voice is critical to that conversation. And we also are really honored that you would spend some time with us tonight talking about this really important health situation. And we hope that we can answer any questions that you, your family, or your community may have, and perhaps address any fears that you or your loved ones, your family may have as well. But with that, I would like to return to Director Stirrup, who can begin the conversation and talk to us. It's been a really busy 14 months, but a really busy day. A lot has changed over since the CDC announced changes regarding when and who should wear masks, and then the city's response today regarding stage 2. So I'm just going to turn it over to you and let us give everyone who's watching the latest on what's happening regarding the health authority revised rules and what we're doing here in Austin Travis County.
Thank you, Ted. Yes, so for the first time since we started this journey of the pandemic, we're in stage 2. And what that means really simply is that if you're fully vaccinated and you're at a private gathering, indoor or outdoor, you don't have to wear a mask. If you're fully vaccinating and you're traveling or shopping or dining, wearing a mask is still recommended, even if you are fully vaccinated, just have one vaccine, or waiting to get your shot. With that, I can still say, even for fully vaccinated people, masking is always the best option, especially if you're around folks that are at an increased risk and are unvaccinated. So now it's about the community, right? What can we do to keep one another safe? So, I'm glad you're vaccinated, but there's still some of us that are not, and are at greater risk for death or severe disease. So we need to do our part and make sure that we're masking when we're in their presence. There are some places where masks are still required. It's our hospitals, our healthcare facilities, our long-term care facilities, our congregate shelters. And on a federal level, we know that our leaders at that level are still asking those of us who work in jails and prisons, if you're riding mass transit, and that includes air travel, or in schools, that you continue to mask. I know there's a lot of talk today about the governor's orders and how those differ from what our health authority has put forward. And we are reviewing his orders, and we're working on a response. But at this time, we don't have any change in our direction or recommendation for the citizens of Austin and Travis County.
Thank you for that. I also wanted to recognize that we do have a ASL interpreter on the line with us. We are so pleased to have an I apologize if I don't pronounce your name correctly, but Melinda Bogdanovich. And I think I may have gotten it right. Thank you so much. And we're so glad you're here. We really appreciate your participation. So thank you very, very much. And again, we will be here to answer questions. Director Stirrup, I know we're going to have more questions for you as we continue on. There has been so much change happening lately regarding masking and who should wear masks and when. But we really want to focus first tonight on vaccines, because that is a critical part of all of us getting back to normal and being able to see family, see friends, begin to gather again, church services, graduations, all of these really important milestone events that we might have missed over the last 14 months, but we're eager to get back to the way things were. And so I want to bring Ms. Hines into the conversation as well. So Director Stirrup and Ms. Hines, and just ask a few basic questions about vaccines. And let's start with, and this may seem basic to some, but could you just reiterate why it is important for everybody to get the vaccine, not just your neighbor, not just that elder that you go to church with, but everybody, why it's important to get that vaccine?
I mean, I think that's the only way that we can really lower transmission rates. The more people that have access to these vaccines, I'm very happy to know that we've lowered it down to the age of 12. we want to get back to our normal lives. We want kids to get back to school. And the only way that we can ensure that is to make sure that everybody has a good immune response and we're not continuing to transmit the virus. As long as the virus is active, there's always a greater chance of variants developing. And there's then the potential that the vaccines that we have available now may not be as protective as we know they are at this present moment. So I think it's imperative that as many people get vaccinated now as possible.
Will you explain what variant means? I think we hear that a lot, but could you just in basic terms explain what that means when you talk about different or new variants?
Well, pretty much viruses mutate. That's what they do. They get in your body and they tend to get inactive pretty quickly, in the sense that they may not always regenerate the same way. And as they're replicating their RNA or DNA, they always have the potential of making a stronger virus. Sometimes it may be weaker. We just don't know. So there's always a risk that as it mutates again, what we have or what we know as protective vaccines are no longer of good value to us. And that's going to continue to happen unless we can suppress the virus from replicating. And the only way that we can do that right now is to make sure that everybody is vaccinated.
And can you also explain how you, as a medical professional, how we know that the vaccines are safe?
Okay. I guess we got to go back to the technology. And I mean, this was something that I had to look up myself. So I'm going to be honest with you. So the technology is new to use with this particular vaccine, but the technology that we're using to make COVID, the COVID vaccine, has been around for a couple of decades now. So that safety data has already been done pretty much. The other part of the data is just right now that we have this vaccine, just to see how it works in the population. And we had to do a lot of those studies kind of head to head because, you know, this is a world pandemic. People are dying and we're trying to combat this as quickly as possible. So it's not that there was any shortcuts that were taken to determine whether or not the vaccine was safe or whether or not it was effective. It was just that a lot of things had to be done at the same time, whereas when we normally do studies, we do it in stages.
I'm going to take a question from somebody who's watching, and I believe this is for Pastor Freeman and Pastor Sneed, but the question is, as men of God of faith, have you been fully vaccinated? And what gave you the peace in getting the vaccine? Pastor Sneed or Pastor Freeman?
I'll answer first while I feel like I have. Maybe not. I think my internet is going in and out.
Yeah.
And so, can you all hear me?
It's getting better.
Can you hear me?
Yes.
Yeah.
Okay.
Yes.
Pastor, you may want to turn off your video and just do it via phone because the video may be slowing down your ability to transmit. Pastor Sneed, did you want to take that question while Pastor Freeman's reconnecting?
Yes. So to answer the question, yes, I have been fully vaccinated. I don't know if it matters, but with Pfizer. And so have my wife. My wife works in the medical field, and so I let her go in first. I was just being such a gentleman in the midst of that. So, but I definitely, we did the research, a lot of research, and seriously, you know, she aided us in making that decision. and obviously other medical experts as well. And so I think the latter part of the question was what gave us the peace.
The peace to get the vaccine. Yes.
I don't want to just turn it into a spiritual thing, but the process was we spent a lot of time in prayer. I think that some of the reservations that individuals have now were certainly some of the same concerns and reservations that I had at the very beginning. Not knowing when the vaccine was, approved, and not knowing the background of the vaccines, and thinking that, it just popped up on the scene, respectfully, especially as an African American male. In the back of my mind is historical context. I still remember what I've learned concerning the Tuskegee experiments. Then, of course, when you're on social media, you have so many social media experts that have their own views, thoughts, and opinions. So that can also skew one's thought and enlightenment as well. So what I had to do was, as I stated, lean on those medical experts to give us insight concerning it. Definitely prayed, definitely vetted it. Individuals who have, were vaccinated, understanding and getting context from them as to what their experience was. And then again, multiple individuals, quite a few individuals, at my job, I work at the University of Texas as well. So being able to lean on some of those experts there to gain information concerning it. And so those are the things for me that gave me the peace. Obviously, spiritually being in prayer concerning those things. And, the scripture teaches us to get godly counsel. And that's what I did in the midst of moving forth to be vaccinated, and even more so, like for our kids, it was mentioned about the teens, the age being released. And so my children, have went through the process as well and received the first vaccination, which my children are 14 and 16. So again, even during that period, just spending time in prayer then, and I wasn't at peace initially. I figure I go forward with not my babies, right? But then, being educated even the more gave me the peace, not only for myself, but also for my family as well as for others.
Pastor Freeman, are you back with us?
I'm not sure. Can you hear me?
We can hear you fine. Thank you.
I am trying to find a place in the building where the signal seems to be stronger. It's storming pretty bad where I am, and so my connection is weak. However, I have been fully vaccinated, and so has my wife, and we actually, our 3 boys had their first dose today.
Wow.
I can be honest and say that it had more to do with the idea of a united front or united push. Like, I feel like we all have to kind of do our part, whether it's wearing our mask, observing social distance, taking the vaccine. We have to work together to kind of get past this thing. And so when I saw that there was a vaccine available that people were taking, and the reaction or negative reactions were minimal, then I saw it as my responsibility to participate in this kind of united effort to move past, this trauma, or move past this hurdle, and just kind of trusting God that the technology or the medicine that was available was to help and not to harm. And I just didn't want to not be a part of the solution. And so that was the reason that I made the decision to move forward. And with my wife and myself, it was a matter of prayer, something we considered. We did not as much research as maybe others did, but we did kind of read into it and make sure we made an informed decision before making that step.
Pastor Sneed, you touched on a couple of things regarding questions we were going to ask of Ms. Hines and Director Stirrup, but one of the questions is, and people have asked and people have talked about to us, is, which vaccine should they get? And I think there's a short answer and maybe a longer answer, but Ms. Hines or Director Stirrup, when somebody asks you that question, what is your response regarding which vaccine?
I say whichever one is available to you.
Yeah.
Whichever one is available to you when you roll up, pull up, walk up, stroll up, whichever one they have, you take that shot.
And there are side effects with the vaccine, and I think we need to be transparent about that. There can be side effects, short-term side effects with the vaccine. And Ms. Hines, do you just want to touch on what some of those very short-term side effects could be? But then if you would also address, because we've had questions from people wondering, are there long-term effects? There's questions about perhaps if you have an underlying health condition or chronic condition, should you be concerned? Pardon me, should you be concerned? Do you want to touch on that?
Okay. As far as the more common side effects to the vaccine, it's there to engage your immune system. So just like if you're going to get exposed to the common cold or COVID itself, it's going to cause maybe a mild fever, a mild headache. But that's kind of letting you know that your body is responding to something foreign, something that shouldn't be there. Anytime we get injections, it's very common to get maybe some redness or soreness at the injection site. There may even be a little rash. So those are the more common things that can happen. Obviously, all over the news, there have been conversations about the Johnson & Johnson vaccine and the fact that it's been associated with thrombolytic events or blood clots. And in response to what vaccine I would tell somebody to get, that may be a conversation that you would have for, a female under 50. Maybe that's not the best option for you if you have a choice. So if you're walking into a center and there are other vaccines available, maybe you would choose something different based on the fact of your sex or your age. But again, I agree. The best vaccine is the one that's right in front of you at that particular time. It's just funny that we have to even answer a question like that. And that is a statement to say how blessed of a nation we live in, that we have the option to even pick and choose a vaccine. My family's from the Caribbean and they're still waiting to get vaccines. So, God bless America.
We have a question that's really a follow-up to what you just addressed, but one of our viewers is asking, why are there side effects from Moderna, but little to no side effects with Pfizer?
I won't say that's exactly true. I think everybody kind of responds to vaccines differently. So what I've heard from patients who've gotten one compared to the other, for a lot of people, the initial vaccine with Pfizer for a lot of people didn't have much of a effect with the first vaccine, and they may have gotten more fatigue or some headaches once they received their second vaccine, and kind of the reverse with Moderna. I know, for instance, I got Moderna and I had more side effects with the initial vaccine than I did with the second one. But I think all of us respond sort of differently, and it's very common that you might not have any side effect at all, and you kind of wonder, is this working or not?
And currently the Pfizer vaccine is the only vaccine for people 12 and over, so kids 12 and over. I'm going to bring Elder Greer into the conversation. I was going to anyway, but then somebody's reading their mind who's watching via Facebook Live. But you're out in the community, and so you bridge. You're a registered nurse, but you're also in the community, encouraging and motivating people to get the vaccine. And somebody's asking or has heard that there are side effects that last 2 weeks or longer. And I know you've just received a lot of questions from people who may have a certain health condition and they're worried about getting the vaccine, which they have legitimate fears, and I'm just wanted to know kind of how you address those fears, and what do you say to people when you're counseling them?
That each person, like Ms. Hines said, each person is different, and each person can have other issues that can exacerbate the shot. So I always say, go to your doctor. If you're having long-term effects about anything, the shot, your sight is bruised and sore for too long, go see your doctor. And it can be, it's always different for different people. All of our bodies are different. So you can always find someone who's had a harder time than someone else, but you should always seek medical advice when you are having issues longer than two days.
Thank you. I want to pause and just remind people who are watching, you can ask questions via Facebook Live in the chat section. We will try to get to as many of those questions tonight as we can, but we will continue to monitor the Facebook page and capture your questions and send out responses. I also wanted to just remind people, if you are looking for a vaccine, there are many ways to find a vaccine near you. Perhaps one of the easiest is if you have access to the internet, you can go to vaccines.gov. That's vaccines with an S.gov. And like magic, it shows up on the screen, or call 311 and you can be directed to a vaccine near you. And I want to run through what Community Care is currently offering. And this does change frequently, but you can, if you're a Community Care patient, you can get a vaccine at most clinics by appointment. There are no appointment vaccines available at their new Manor clinic. It's the Manor Vaccine Clinic at 600 West Carey in Manor. And that's from 8:30 to 4 only on Wednesdays. So that's only on Wednesdays. So tomorrow you could go to the Manor Clinic and get a vaccine, ages 18 and over. There's a clinic in East Austin, the Rosewood Zaragoza Vaccine Clinic for Community Care patients. And this is Friday, Monday through Friday, 7 to 2, Saturday, 8 to 4. And they are offering the Pfizer vaccine for children 12 and over. And then there's also the East Travis County vaccine location. This is a collaboration between 5 counties, including Travis County, Austin Public Health, Community Care, and that's the Travis County Expo Center on Decker Lane, which is Friday, Saturday, Sunday. No appointments are necessary. And one more note, if you are a Community Care patient, you can go to their website, communitycaretx.org, and you can click on a link to register for an appointment. Just go to coronavirus updates, vaccine information, or you can call Community Care at 978-9015. We'll repeat this at the end of this conversation. Now I'd like to invite Pastor Freeman, Pastor Sneed, Elder Greer, everyone back into the conversation, and wanted to kind of go back to messaging and what you're telling your congregations about the vaccine. And I'm curious if you have heard hesitancy. Give us a feel for what your congregations are feeling and telling you, and what you're using to motivate them to get the vaccine.
I'll jump in. Several individuals in our congregation, especially in leadership, have already been fully vaccinated. And honestly, I've tried to just kind of make information available and to make the necessary connections more than I have tried to actually encourage people to. I think to a certain extent, everyone should do their own research and be informed about the decisions that they make. And so I haven't kind of tried to shame anyone or force anyone into doing it, but definitely do my part to make sure that the information is available, those who have wanted to get it, to try to point them in the right directions. And we've done things as simple as creating a specific place in the sanctuary where people who are fully vaccinated can sit. And I think in some way that would encourage being vaccinated as well. So my thought has been to provide opportunities and information more than, telling people that they should. And maybe I should ramp up or become more aggressive in that, right? But at this point, I have not just wanted to put it in front of individuals. So if it was something that they were wanting to do to join this united effort, that they could do that.
And in general, have you found that your congregation is that they want the vaccine? Are you sensing any hesitancy or concern about getting the vaccine?
I have not heard it voiced. As a matter of fact, on our live stream Sunday, right, we had a good number of people in the sanctuary, but of course more people watch virtually. And I kind of just asked, people to indicate in the comment section whether they've been vaccinated or not, and an overwhelming majority of them actually had. And so I haven't heard anyone say that they hadn't because of any particular reason. And I haven't heard anyone say that they were not going to, that are a part of our congregation. So, of course, that it may just not have come to me, but I haven't heard any strong opposition.
Pastor Sneed, what's the pulse of your congregation?
So there it's mixed, to be honest. There are those that have excitingly been fully vaccinated and have become advocates in their own right. Then there are those that still have reservations and are somewhat reluctant. And so there's a very clear mix of desires and focus in being fully vaccinated. And so similar to what Pastor Free stated about, I've just been very sensitive to individuals just in this season period, and just been extending grace to individuals, but making content, making information available so that individuals can make their own informed decision, while at the same time, when individuals ask, and I'm able to share with them, that I would much rather be vaccinated and fully vaccinated than running the risk of contracting COVID, as been stated. And so just sharing my own personal stances and convictions, and hopefully that level of influence and surety or courage could encourage someone else to make a decision for themselves.
Thank you. I like the idea of extending grace to individuals during this time for many reasons, but certainly this is an important one. Director Stirrup, this is a question I think you might want to address. A question from one of our viewers regarding initiatives to reach Black and Brown, the deaf community, regarding educating them about clinics in the community. And I'm wondering if you have any specific information about any outreach that's been done to the deaf community. And we are very honored to have somebody here interpreting for us tonight. And if not, we're happy to get back to this person with a better answer if you don't know anything.
So at all of our mass clinics, either at Delco, Southeast Library, or Little Walnut Creek, we provide services, ASL translation, and actually a kind of ambassador person who can walk someone through the process. Maybe about 2 months ago, we partnered with Travis County to have a special pod for the hearing impaired. And so we will continue to, as the need is surfaced, we have our mobile vaccine team that can work with an agency or a group to put on a closed pod for that community. And also, just know that we've really worked hard to make sure that our sites are accessible to anyone, no matter what language you speak, or no matter what type of assistance you need to walk through the process.
Thank you. We've got some more questions for our pastors, and we do have several pastors on the panel tonight. So I kind of just ask the question and see who answers. But one of the questions is there any scripture reference that people could share with family and friends who are spiritual, but are also afraid of the vaccine? This person said they've waited eagerly for weeks. I added eagerly, but they sounded very eager. They've waited for weeks for this meeting. So I wonder if anybody would like to share any scripture that you believe is relevant, that they could share with family and friends who may still be a little bit fearful of the vaccine.
Adrian's laughing because she knows I'm going to take it.
I'm looking at Pastor Shirley too, so I think
there are a number of instances in the Bible where Jesus uses, or God uses medicine. They had one of the pandemics that they had was the death of the firstborn. And what God told them to do was to put the blood of the lamb over their doorpost, and so that the death angel will pass over. So that was the vaccine for the Passover. There was a blind man that Jesus ran across, and he put his hands in the dirt and he put spit on it and he rubbed it together. He put it on his eyes, and the man became, he was able to see. He also had what our nurses know. He had the bronze snake and the staff that we now use as our symbol for medicine. And he had the people who were sick touch the staff, and they were healed from their ailments. So it is throughout the Bible how God uses medicine to heal. And also, I say the healer of all healer, which is Jesus, walked with a physician, which was Luke. So if Jesus needed a physician and he needed to know what was needed to have a physician with him, why wouldn't we listen to what a physician had to say?
Well said. Anybody else want to weigh in? Pastor Shirley or any of you? Sorry, I'm sorry. I didn't mean to step on.
No, it's good. I'd like to chime in. I believe the question was about specific verses that could be shared. And immediately 2 Timothy 1:7 comes to mind. God has not given us the spirit of fear, but power, love, self-control, or sound mind. And I think perhaps the biggest obstacle, especially for individuals in the African-American community, is fear. And although we may need to be cautious, do our due diligence, be educated, being fearful is not something that comes from God. I consider Philippians 4:6 that we should be anxious for nothing. And that, anxiety concerning this whole pandemic has gripped a lot of people. But those things don't come from God, right? And so as those who are believers and people who are strong in faith, the word of God tells us, to approach these obstacles, these hurdles, these issues and instances with faith, trusting that God provides cure, God provides medicine, God provides opportunities for us to make it past this season of pandemic with confidence, with boldness. So those are at least two scriptural passages that immediately come to mind.
And you also addressed a second question that we had from one of our viewers who said, do you feel that getting the vaccine is showing a lack of faith or trust in God in the midst of the virus? And I think you just addressed that.
I don't know if I did, but I do believe Mia did, because as it was stated, there are numerous instances in the scriptures where medicine is used. And so I don't think that it's a lack of faith in any way to lean on medicine, because I believe that that's a gift from God. I believe technology, knowledge, progression, all those things God gives to us to help us to live full and actualized lives. And so faith and those things to me go hand in hand.
I just wanted to chime in on that as well. The scripture that always comes to mind, and I'm not good with the biblical books as far as where it comes from, but I always think of the talents. You know, God gave certain people a certain number of talents, and he punished the one that didn't use his talent. And I think we're all here, we all have a purpose, we all have a gift, and medicine is a gift. Being able to heal people is a gift. And I think it is definitely a curse not to use what God has blessed us with. So when we think of vaccines, or we think of ways that we're trying to, cure people of cancer, these are our gifts, and we're trying to make a difference for our people, God's people. So that's what usually comes to mind to me.
Thank you. Ms. Hines, while I have you on screen, can I ask you another question from a viewer? And this is going back to vaccine safety and potential long-term effects. But this person asked, since the vaccine was mass-produced with limited options for research for long-term effects, and they mentioned pregnancy, fertility, thyroid function, hormones, how are we able to anticipate what could occur or be correlated? And perhaps you or Director Stirrup might want to address that question.
The best way that I can think about answering that question is just thinking about how vaccines really work. And we're kind of injecting a protein or a denatured virus into the body, and your immune system is sort of responding to that. It recognizes something foreign and it's producing antibodies, and then that foreign material is actually removed from your body. So in general, there really shouldn't be any long-term effects from vaccines. Now we can have, reactions to maybe the preservatives or what we're using to, what would be the best word that I'm looking for, that we're using to preserve the vaccine in. So some people can have reactions to that, but they shouldn't really be long-term. I would think in general, if you're going to have a reaction, it usually happens right away. We do have some delayed sensitivity reactions that may happen, several weeks later. But I would say in general, probably most of your side effects that should occur should be less than 12 weeks. I don't know, anybody correct me if I'm wrong, but.
Pastor Shirley, I have a question for you, and you have a very unique ministry, and perhaps you could just briefly tell our panel and the viewers about your unique ministry, but also curious, what are you telling people when you are going into the jails and counseling people there about the vaccine?
Basically, right now we're not going into the jails because of COVID. But what I tell people is I hear a lot of the fears, real fears. People are really afraid of the vaccine. I had someone to tell me, well, his doctor offered him the vaccine, and he said, no, I'm going to wait for the J&J. Well, when it came out, there were side effects. So now he's not going to take the vaccine. He's just totally not going to take the vaccine. But I don't just minister to the offenders. I minister to the sheriffs. And what they're saying is they've been vaccinated and they're still afraid to go to work because the population in the prisons are not fully vaccinated. And then so many of them have had COVID. And so it's right now, I tell people, you know, you've got 6 in one hand, half a dozen in the other. What choice do you have? What choice? And be wise about it. I mean, always be wise about it. Because when we seek God and we seek wisdom, then we always come up with the best and the most wisest decision. And this is, you're not just protecting yourself, you're protecting people around you. So what I tell people is, what about your grandma? What about your kids? Think about those whose presence you just come across all the time. What would you do if you were not vaccinated and someone else is, or you're vaccinated and someone isn't, and there's COVID? Think about every time you walk into a room, you should be concerned about what's in that room. I'm the type person, I still wear a mask and I wear gloves in the grocery store because I don't know who has and who is been vaccinated. And I tell people, you know, look around you, listen to the science. What choices do we really, really have when it comes to getting a vaccine? What choices do we have? We need to stop and think about all the deaths, all the cases, and think about how it's decreased since the vaccine has become available. And again, it doesn't matter which one you take, as been said, just take one, anyone. But I also tell people that you need to not be selfish and just think about yourself. Think about everybody, the community as a whole.
Thank you. Director Stirrup and Ms. Hines, we have a couple of different questions in our chat regarding vaccines and children. Would you mind just clarifying who the ages that can now get the vaccine here in Travis County? And then there is a couple of questions about regarding whether there are increased risks for children or youth getting the vaccine, including perhaps children with underlying health conditions like asthma. So would you mind just clarifying the age limits of age requirements for who can get the vaccine in Travis County?
Sure, I can talk about the where, and then Ms. Hines, if you could talk about the risks.
Perfect.
So anywhere that the Pfizer vaccine is offered, you can take your child that is 12 and older to get a vaccine. Pfizer is the one that you want him or her to get. So at the Expo Center, I know they offer Pfizer. UT is currently offering Pfizer. Walgreens has Pfizer. So anywhere that you can get Pfizer, your child 12 and older can go get a vaccine.
And Community Care offers the Pfizer vaccine. I misspoke earlier. They offer the Pfizer vaccine at Maynard Clinic, which is open tomorrow, and at Rosewood Zaragoza, which is open Monday through Saturday. Ms. Hines, do you want to talk about any concerns that young people, children, youth, or parents may have for their kids getting the vaccine? And also if a child has asthma or underlying health condition?
Well, first of all, I think kids have a more robust immune system than we do. So they respond a lot better to the vaccines. And that's why we give vaccines to toddlers, just because they will develop a better immune response. Now, getting back to the question about the children with asthma or underlying health issues, the vaccine is even more imperative for that population to get, because the effects of them getting the actual COVID virus when they have underlying health conditions can be detrimental. So I think it's even more important for that population to get the vaccine.
I think that's a really good point that maybe we sometimes forget to emphasize, that people who are more vulnerable from a health perspective, the elderly or people who do have underlying health conditions or other situations in their life, they especially need the vaccine. I have a question for our pastors, and I could probably answer this, but not nearly as eloquently as you. I would just say yes. But somebody is asking if you would be willing to let your church be a location for vaccines. So perhaps having offering vaccines on a Sunday after service.
I can speak to that. I'm a messenger at Greater Mount Zion Baptist Church, 4301 Tanny Hill. And we've partnered with Austin Public Health and someone else, and we've offered vaccines.
Almost, I think.
Yeah, the discouragement is we had 250 vaccines and only 114 people showed up. So when we got the word out, or we thought we did, we got the word out, and we really made sure that everybody knew that we were vaccinating and it was available. I mean, weeks in advance. So my thing is, when we do this, where are the people who haven't been vaccinated, and what are their fears, and why don't they show up for the vaccination?
Pastor Sneed, I didn't know, has your church been offered vaccines like on a Sunday after services, or is that something that you are considering or would be open to?
We would totally be open to it. I mean, holistically, whatever we can do to enhance and advance our community, we're always in. So, I mean, we kind of stand by the thought of we don't do church, we do ministry. And so we believe this will be a great service and a ministry to the community. So, you know, the short answer is most definitely yes.
Pastor Freeman, has your church done this, or is it something that you're considering?
Our church has not been presented, I guess, with an opportunity to be a site where individuals can get it, and kind of like, well, not like Pastor Sneaker. We do church and ministry. We run around, shout, get happy, and then try to serve the community. But at the same time, my thought is many people's excuse is probably convenience. You know, early on, it was a matter of standing in lines and having to find a site and going, and in some instances, the vaccine running out. And I think, you know, those things happening early on caused some people to say, well, you know, I'm just not going to deal with that, even though that's not the case anymore. So I do think that, you know, putting the vaccine in places where people naturally gather, as churches are reopening and people are coming back together, would be an ideal method or means to kind of make the vaccination available to more people. And so we're definitely willing to participate in that vein, for sure.
I think that's a really important point. Just the availability of the vaccine has increased dramatically in the last few weeks even. And so we will remind people, if they're looking for a place to get the vaccine, they can go to vaccines.gov and you type in your zip code and it populates vaccines within 5, 10, 15 minutes of where you live. And then, of course, the Austin Public Health website and the Community Care website can also connect you. There's the magic slide again, but vaccines.gov or call 311. And then there's the list of no appointment vaccines for Community Care. Community Care is currently offering vaccines for patients at most clinics, and then non-patients can also get the vaccine at the Maynard Clinic. And there's also a Pflugerville vaccine site coming soon for Community Care. We have a question.
I'd like to add before we leave that, the Rock ATX, we are doing in partnership with Austin Public Health, we are doing a sign up, but I wanted to talk about what Miss Shirley was saying about where the people are. We find them. We call, we find them, we go to the probation offices, we talk to people in the grocery store, we call churches, we actually go and find them and make them have an appointment. You know, we will, hey, have you? We don't just hope people come to us. We go find them. So we think out of the box. The barbershops, we'll call the barbershops. We'll call the and Ted can tell you we've turned in numbers that's very, very high for people who have been vaccinated through our system. We can't, as African Americans, wait for them to walk up to us. We've got to bring them hand in hand, walk with them, bring them, because even though that there's a fear, I would fear death before fear getting a vaccine. And so where they are, if they won't come, hold their hand and bring them.
And we have partnered with Community Coalition for Health and Latino Healthcare Forum, and through their amazing boots on the ground efforts, visiting more than 1,000 businesses, apartment complexes, communities of faith in high-risk zip codes, dropping off informational toolkits, personal protective equipment, masks and hand sanitizers, and then just that one-on-one interaction. They've assisted with signing up thousands of people to get the vaccine, either to make appointments or just to get them to a location where vaccines are happening. So it is that grassroots, boots on the ground effort that has, I believe, made a difference. And today, and Director Stirrup, you would have more details than I would, but I believe today it was announced that Travis County has reached an important milestone. More than 400,000 people have been vaccinated. Is that correct?
That is correct. I believe, I know, right?
That's
I believe
great.
it was maybe 417,000 some odd folks. So yeah, that is great news. But the sombering fact is, right?
Right.
If you look at the rates in our communities of color, we're not where we should be. So it's kind of like, yay, oh, but still, I mean, the 400,000 number just shows as a community how we've all pulled together to make this work, to make the effort, to make sure that people got vaccinated. And we just have a little bit more to go.
Oh. There's a question specifically for Ms. Hines from one of our viewers, and I'll ask the question if you may or may not know the answer, but the question is, has anyone who is vaccinated ever transmitted the virus? Are you aware of any data, or have you heard any stories about that, someone who had the vaccine but still transmitted the virus?
No, not personally that I've experienced that, but from what they say about the vaccines, I think that we're still learning that's the bottom answer to that. But I guess there's always a concern why, especially with all the back and forth with the mask mandates, is that yes, it's possible that we may potentially get exposed to the virus from someone who has it. We may not potentially get infected or acquire disease, but is there a risk that we can still transmit the virus? And I think that is a question that we really don't have the answer to, but that's why we're still so concerned about wearing masks in large gatherings where you may be around people that are not vaccinated or are not fully vaccinated, because there is the potential that we can carry the virus even though it is not causing any disease.
We have a question from a viewer, and this is also a question that has come up a lot. We partner with UT Austin, Dell Medical School, and UT Austin has been vaccinating thousands of people as well. And they hear this from students, male and female, but it's a question. I know that Elder Greer has heard this as well in her work on the streets, but are vaccines safe for pregnant women or women who plan to get pregnant?
Short answer, I would say yes. And that's because, again, there's always a potential risk that, moms already compromise when she's carrying a baby. You know, she has to share everything between her and the fetus. So if she should get potentially exposed to COVID, obviously her risk could be a whole lot worse than if she actually got the vaccine. The problem is most clinical trials that we do, we never really do it on pregnant women. So most of the data that we have is what we call real world data. And that's where people potentially have gotten the vaccine or in between vaccines and they're pregnant, or, you know, people are just adamant about getting it and, you know, they go ahead with the vaccine, and we follow those people. So I think that's still data that we're collecting, and we may not have a good answer yet, but so far from the little that I have read, it seems to be worthwhile for women that are pregnant to get the vaccine.
And we still hear people ask if the COVID vaccine can give you COVID. The answer is no. There is no COVID live virus in the vaccine, but we
Correct.
still hear that question a lot.
Yeah, and I think that's just trying to understand, you know, how vaccines work. Pretty much what we're doing is just taking a protein that the virus is coated with, and usually it's something that's potentially a part of the virus that actually is what causes most of the disease. And they use part of that protein in these vaccines, and it initiates an immune response when it's entered into our body. So our body is amazing. God has thought about everything, but our immune system pretty much is designed to identify something that shouldn't be there, and it's trying to get rid of it. And that's pretty much what our immune system does. So you get injected with this vaccine, your body automatically recognizes that it's something that shouldn't be there, and it's developing an immune response. Now, why that's important is because when you think of you actually getting the virus, now you're getting the virus, millions of particles are entering your body, but your body has not gotten a chance to initiate that immune response. So you're sick already before your body could start producing antibodies to do anything to combat this virus. And that's why vaccines are important, because it's initiating that immune response before you actually get exposed to the virus. So if you should get exposed to it later on, it's already recognized this thing. Oh, I know what this thing is, and we're going to get rid of it before it can do any harm to you.
Thank you. I want to give everybody, first of all, I want to thank everybody who has joined us tonight. You can still, if you're watching from home or from your car or from your office, you can still share a question or a comment in our Facebook Live chat feature. And if we don't get to it tonight, we will capture all the questions and respond to them. But as we begin to come to the end of the evening, I would like to give all of our panelists, first of all, thank you again for being with us on this stormy evening, but just give you a chance to maybe say a few offer a few closing remarks, whether it's for your congregation or just people in the community about where we are now, the fact that I'm actually seeing maybe the sun or the skies clearing, which is a nice metaphor perhaps for where we are now with in this pandemic, that perhaps we are on the verge of getting back to normal. But if you would just take a few minutes to share a few closing thoughts, perhaps after being together tonight, what's on your mind? And I will go in no particular order, but right now, Ms. Hines, you're on screen. So I'll start with you and we'll just kind of go around the circle.
Well, I guess I would say that, you know, it takes a village. We all have to do our part in order to make a difference. And a simple sacrifice is what we're making for the greater good. And, you know, worldwide problem. It's not just here, it's everywhere. And we got to do our part to make a difference.
Thank you. Director Stirrup.
A lot of different thoughts going through my head, but I think back to what Miss Shirley said, and we go to the same church. Hope to see you on the 6th. Um,
I know you have to know
you know,
Pastor Shirley if you go to the same church, or if you don't go to the same church, if you just live in the same city.
And at this point, what is it, right? What is it that's going to make people come? And I think back to when, the medical community was really pushing the HPV vaccine. And I was like, oh, I'm not going to do that. Dad and I were like, no, we don't like that. It's targeting young girls. What are they trying to say about my daughter? We're not getting that. And then they ran those ads where they showed the woman as an adult with cancer, then going back. And at the end, she turns around. Did you know, Mom? Did you? And I was like, oh my God, I do know. Right? And I made an appointment and I got her a vaccine. So it's that same kind of conviction that you have to have. What is the best thing that you can do for yourself and for your family? And at this point, the experts are saying it's a vaccine. And so I hope that everyone looks for that thing that's most important to you that you want to protect, and you consider making that choice for yourself and your family.
I love how you deliver a message as a public health expert and executive, but also as a mom. So that really brings it home. Elder Greer, I know you have something to say. How would you wrap it up for tonight?
Well, I'm a little more pushy. I am very, very concerned about the African American. We already go through enough. We already are the highest in everything but accidents when it comes to the top diseases that we have. We don't jump out of airplanes and skydive and that, but we do get hypertension and we do die of heart attacks. And I know the numbers are so very low. The last I looked, I think it was 4% African Americans that have been vaccinated. And that's sad to me because when we start 5%, we went up. So now we're 5% African Americans who have been vaccinated. And I just think that's a doggone shame because we are the first to die of almost everything. So why do we need to be the first to die of this? We don't have to. And I am not going to be the nice person. And people who go to my church, they know it. I'm like, why aren't you getting the vaccine? That doesn't make sense to me. You don't know what's in, when you go to the doctor, they don't tell you everything that's in your medication. You have no idea. When you have surgery, you don't know what they're putting in you. You don't know what they're doing. So why are you so concerned about what is going on with these freaking vaccines? I don't understand it. And I want it to stop because I want you to live.
If I saw you coming at me at church, I'll be heading straight to the vaccine clinic. That's all I know. Pastor Shirley?
Elder Greer, it's 6% as of today. I was in a meeting today at Community Care. It's 6% now for people of color. I'd like to say that, this pandemic has changed so much of the way I do ministry because I have a mentoring program. Whereas if you needed to get somewhere, I got you there. But now I don't put you in my car because if I say, have you been vaccinated? And you say no, I'm one of the vulnerable populations. I'm one of the people who have the healthcare issues, and I just can't afford to do that. But I have ways and means to get you to a vaccination site. It's like you say, it's hard. It's not easy. But if we get in people's faces, being on the board of Community Care, I get in people's faces. And if we get in people's faces and we give them hard facts, true data, then oftentimes they listen. I mean, we're not going to save the world. We're not, everybody's not going to do the right thing for the right reason when nobody's looking. But if we can just touch a few, if we can reach a few, then our mission has been accomplished.
Thank you. Pastor Sneed, there you are. Any final thoughts for us tonight?
One, I just want to thank y'all for sharing the content that y'all have. I think that a lot of the fear can be erased or eradicated by solid education and empowerment, individuals being enlightened. Even going back to what Minister Shirley stated about the numbers being low. I think a lot of that is also the lack of exposure. I think this is a great platform, and I think powerful content and information has been shared and has been shared prior to tonight. But then just ensuring that individuals are exposed to the information, I believe is what's imperative. And so I'm thankful for this platform and even being a part of it tonight, just to do my part and share, whether it be to the Christian community or to my Black and Brown community, or just, in my area, in my region, just being able to share and encourage individuals to potentially take a leap of faith. But then also being educated and knowledgeable concerning those things and making a well-informed decision. Can I share this one scripture? I was going to share it earlier. I'm not going to preach like, Pastor Free and Elder Greer did, but it's just one of my favorite passages of scriptures that talks about fear. So many scriptures in fear, and I actually put it in the chat. But it's in Isaiah chapter 41 and verse 10, and it says, "Fear not." God is speaking. He said, "Fear not, for I am with thee. Be not dismayed, for I am your God. I will strengthen you. I will help you. I will uphold you with my right hand of righteousness." And so I just want to encourage individuals that may be fearful, don't live in that state. And at the same time, we don't want individuals to be living life in regret as well. So just thank you for tonight. Thank each of you, the medical experts and those that have, boots on the ground and doing everything you can to educate our community, seeing those numbers go up. So just thank y'all for all that you do consistently for our community. God bless.
Thank you so much for sharing those words of inspiration and for being here with us tonight. I wanted to give our CEO, Mike Giesland, a chance to share any closing thoughts if he would like to, and then we will wrap it up on time tonight. Mike, are you there?
Yes, I am. Thank you, Ted. And I want to thank the faith leaders, Director Stirrup, Ms. Hines. It's just been great having everybody here for this conversation, and our sign interpreter as well, and those of you that have joined us by Facebook. We've talked before about how we stand at many intersections, and one of those intersections is here tonight between faith and health. And there's different directions, or there's different roads that we can take. But know this, should you be concerned? Are there fears? Are they real? Yes. But do you have support? Do you have love? Do you have righteousness? Do you have others that are willing to take that walk with you? Absolutely. And so I think this conversation has been uplifting. It's been inspiring, and it's certainly renewed a commitment towards, I think I can speak of everybody at Central Health as public servants in serving the communities that we are so privileged. Thank you very much. It's a great and wonderful conversation. Appreciate it.
Thank you, Mike. And I do want to thank again Melinda Bogdanovich for joining us tonight and providing interpretation services. We really do appreciate your time as well. Just a quick reminder, if you're 12 and over, you're eligible for the COVID vaccine. Vaccines are safe, effective, and they're free. You can get a vaccine without an appointment. They're no cost and no ID. So there's many ways to find a vaccine near you. Perhaps the easiest is to go to vaccines.gov. You put in your zip code and you can find a vaccine, or you can call 311 or 512-974-2000. Austin Public Health's website is a wealth of information. You can also visit centralhealth.net/vaccine. That's a lot of information. We'll put that in the chat and we'll continue to share it. I am honored to have been your moderator tonight. I feel like I get to go to church on Tuesday night, so I'm good for the rest of the week. So it's a pleasure to be here and to be with so many esteemed experts, so many eloquent and passionate experts. So thank you so much for your time. And remember, stay positive, test negative, and get your vaccine. Thank you, everybody, and have a good evening.
You as well.
Thank you.
All right. Bye-bye.
Thank you all. That completes the stream. So thank you for joining us. I enjoyed the conversation and we had a lot of good activity on Facebook. So thank you. Good night.
Good
Good
night.
night.
Yeah.